So eating right for exercise and health is a pretty broad topic and not one that I can cover in a short video. However, I want to give you some basic ideas about things that you should consider. For one, if you're trying to manage your blood glucose and your body is having trouble managing all the carbohydrates that you eat, the most logical thing to do is actually cut back on your carbs, or at least moderate intake of ones that cause your blood glucose to spike rapidly. So the ones that are absorbed really quickly, the ones that are sort of partially digested for you in advance by the manufacturer, white rice, they take the outside off the rice, or highly refined products, those are going to tend to cause a bigger rise in your blood glucose after you eat them. So you may just want to consider moderating those. When it comes to exercise, though, sometimes you can use those strategically to take in during exercise to prevent your glucose from dropping too far. And you may want to figure out how to, especially if you're an insulin user, how to balance your food intake with your carb intake and other foods as well. So there's a craze right now that's kind of a low-carb craze that has really hit the diabetes world as well, and some exercisers. And it seems to do okay once people have adapted to it when they're doing endurance or ultra-endurance type activities, but may have a negative impact on doing power types of activities. So that's something to consider when you're choosing your diet to follow. Remember though, if you need to treat low blood glucose, the best thing to treat it with is a rapid acting source of glucose, which is anything that contains glucose, basically. So sports drinks, glucose tablets, of course, glucose gels, Smarties, things that have dextrose in them, which is another name for glucose. So use those first and then back those up with a more balanced food or drink that contains some protein and fat as well that get metabolized more slowly in order to get optimal balance of your glucose over time and to prevent lows.